Hello guys, welcome to this video. So today we will be talking about three others evolving diseases or viral diseases. These are the Ebola virus, the Zika virus, and the SARS. So I hope you'll keep on watching this video. So today we will first discuss about the Ebola virus disease. So what is EVD? Ebola virus disease or EVD, formerly known as Ebola hemorrhagic fever, is a rare but severe and often fatal illness in humans, with occasional outbreaks that occur primarily on the African continent. The virus is transmitted to people from wild animals and spread in the human population through human-to-human transmission. It is thought that fruit bats of the Theropodidae family are natural Ebola virus hosts. Ebola is introduced into the human population through close contact with blood secretions, organs, or other bodily fluids of infected animals and humans. So, the etiology of the disease. The exact cause of EVD is still unknown, but scientists believe that it is an animal-borne and most likely comes from the bats, which transmit the Ebola virus to other animals and humans. There is also no proof that mosquitoes or other insects can transmit the virus. Once infected, a person can spread the virus to other people. The Ebola virus is not as contagious as common viruses such as colds or the flu. It is not spread through air, water, or food. The virus is spread through direct contact with blood of a person infected with the virus, body fluids, objects such as the needles or syringe, and also this virus is from the Filoviridae family, genus Ebola virus. So the risk factors of the disease, first is travel to Africa. You're at risk if you visit or work in areas where Ebola virus outbreaks have occurred. Number 2, conduct of animal research. People are more likely to contract the Ebola virus if they conduct animal research with monkeys imported from Africa or the Philippines. Next is provide medical or personal care. Family members are often infected as they care for sick relatives, and medical personnel also can be infected if they don't use specialized personal protective equipment that covers them from head to toe. And lastly, prepare people for burial. The bodies of people who died of Ebola virus are still contagious. Helping prepare these bodies for burial can increase your risk of getting the viruses. So, the pathophysiology of the disease. The Ebola virus, which is infection through mucosa and injury on the skin. And then this will infect monocytes, macrophages, and dendritic cells in tissue and mucosal tissues. And then it will cause a synthesis of viral protein and inhibition by it of neutrophil activation. And then it will lead into migration via lymphatic system and blood. And then there will be a spread of infection to lymph nodes, liver, spleen, and adrenal gland, and then continued viral replication in monocytes, macrophages, and dendritic cells, and in endothelial cells, fibroblasts, hepatocytes, adrenal cortical cells, and several types of epithelial cells. And then it will lead into viral protein GP causes reduction in availability of integrins that are responsible for the intercellular cell adhesion structure. The VP24 and VP35 viral proteins block the type 1 interferon-led antiviral response by blocking the synthesis and/or functioning of interferon alpha and beta, and also the static signaling protein that triggers interferon-stimulated gene expression. Thus, the RNA silencing mechanism of host is also blocked. And lastly, the virus replicating cells become dysregulated. Unregulated pro-inflammatory response is also triggered. A cytokine storm is created by release of interleukins, interferons, and a number of tissue factors and reactive oxygen and nitrogen. Thus, the apoptosis of T cells, loss of humoral response, and consequent immunosuppression will occur, and tissue damage and multiple organ failure will also occur, and there will be a vasodilation link, increased permeability, and disseminated intravascular coagulation, and lastly, there will be a diarrhea, fever, and inflammation. So this will all cause into septic shock and may lead into death. So the complications. Ebola virus leads to death for a high number of people who are infected. As the illness progresses, the virus can cause multiple organ failure, severe bleeding, jaundice, delirium, seizure, and coma, and also shock. So for people who survive, recovery may be slow. It may take months to regain weight and strength, and the virus remain in the body for weeks. People also may experience hair loss, sensory changes, liver inflammation or hepatitis, weakness, fatigue, and headaches, and also eye inflammation. So one of the reasons that this virus is deadly is that they interfere with the immune system's ability to mount a defense. But scientists don't understand why some people recover from Ebola virus and others don't. So the time interval from infection with Ebola to the onset of symptoms is 2 to 21 days, although 8 to 10 days is most common. So the virus cannot be spread to another person until symptoms appear. The signs and symptoms include fatigue or fever, muscle pain, headache, and sore throat. And this will be followed by vomiting, diarrhea, rash, symptoms of impaired kidney and liver function. Then in some cases, both internal and external bleeding. And the laboratory findings include low white blood cell and platelet counts and elevated liver enzymes. So the diagnostic test includes the reverse transcription polymerase chain reaction. So this molecular test look for Ebola virus RNA in a blood sample. This can be used with saliva samples in acutely ill individuals. So next is the Ebola antigen test. This test detect Ebola antigens in blood samples also. They typically can detect antigens within a few days after the symptoms begin. So there are two different types that are available. First is the rapid Ebola antigen test. So this test is designed to be performed at the point of care. While on the other hand, the laboratory antigen, these are designed to be performed in laboratories by a laboratory personnel. So next is the Ebola antibody testing, immunoglobulin M or immunoglobulin G class. So these tests are used to detect Ebola antibodies in a blood sample that develop in response to the infection. So the immunoglobulin M class of antibody develops first, while the immunoglobulin G develops later. So these antibody tests in general are best at detecting Ebola later in the illness and are often used in investigating Ebola outbreaks. So other tests also may include the CBC or the complete blood count, tests to evaluate the liver such as a liver panel, tests to evaluate kidney function such as creatinine, and blood urea nitrogen bond. And lastly, tests to evaluate bleeding. So the treatment modalities of the disease. So there is no currently licensed vaccine available for Ebola. Several vaccines are being tested, but at this time none are available for clinical use. At the moment, treatment for Ebola is limited to intensive supportive care that includes getting fluids to prevent dehydration, regulating and replacing salts and other chemicals in the body, maintaining blood pressure, taking medicine to relieve fever, diarrhea, nausea, and pain, and lastly, getting oxygen and treating other infections. So the nursing management, number 1 is prevent bleeding. So instruct the patient to use a soft bristled toothbrush and non-abrasive toothpaste. Limit also the straining with bowel movements, forceful nose blowing, coughing, or sneezing. And be careful when using sharp objects like scissors and knives. And when laboratory values are abnormal, administer blood products as prescribed. Next is restore normal fluid and electrolyte balance. Administer electrolyte replacement as prescribed. Monitor intake and output. Note decreased urinary output and positive fluid balance on 24-hour calculations, and administer oral fluids with caution. And next is prevent shock. Monitor daily weight for sudden decreases, especially in the presence of decreasing urine output or active fluid loss. And monitor also the patient closely for cardiovascular overload, signs of difficulty of breathing, pulmonary edema, jugular vein distension, and laboratory results. And relieve pain. So provide rest periods to promote relief, sleep, and relaxation. And determine the appropriate pain relief method. Get rid of additional stressors or sources of discomfort whenever possible, and provide analgesics as ordered. And lastly, restore the normal fluid volume. Urge the patient to drink prescribed amount of fluid. So if patient can tolerate oral fluids, give what oral fluids patient refers. Then provide fluid and straw at bedside within easy reach. And also provide fresh water and a straw. Emphasize also the importance of oral hygiene and emphasize the relevance of maintaining proper nutrition and hydration. So the nursing diagnosis for this disease is number 1, risk for bleeding related to impaired clotting factors, risk for electrolyte imbalance related to decreased oral intake, vomiting, and diarrhea. Next is risk for shock related to a progressive multi-organ failure, pain related to musculoskeletal and abdominal aches. And lastly, risk for fluid volume deficit related to restricted oral intake, bleeding, vomiting, and diarrhea. So the prognosis of the disease. The prognosis of Ebola hemorrhagic fever is often poor. The death rate of this disease ranges from 25 to 100%, and those who survive may experience the complications listed above. However, early diagnosis and treatment of Ebola may greatly increase the patient's chance for survival. So we will now proceed to our next topic. It's about Zika virus. So what is Zika virus? Zika virus is similar to dengue fever, yellow fever, and West Nile virus. It is carried by infected Aedes mosquito, which bite during the day. Zika is largely transmitted through bites, but can also occur through intrauterine infection. So, if a woman is bitten by an infected mosquito and becomes infected, Zika can cross into the placenta and affect the fetus. While anyone can contract Zika, pregnant women are the most at risk due to the potential for fetal microcephaly and other abnormalities in neurologic. So, sexual transmission of this virus can occur. Transmission has been reported from infected men and women to their sexual partners. The virus can also be transmitted through anal, oral, and vaginal sex. So the etiology of the disease. It is from the infected Aedes species mosquito from unprotected sexual intercourse. Transfusion of blood and blood products, and organ transplantation. So the risk factors that put you at a greater risk of developing the Zika virus includes living or traveling in countries where there have been outbreaks, and having an unprotected sex. So this is the pathophysiology for the disease. The Zika virus that is carried by the Aedes mosquito. It will be transmit into body through the bite. Then it will transfer via sex and transfer from mother to fetus that may be causes microcephaly to the fetus. So the transmission that was happened through the bite of the mosquito will enter into the liver. The virus may enter into the liver and replicates in RBC. Thus, the Zika virus transfer into the mosquito by an infected person. So the sign and symptoms. The incubation period of Zika virus disease is estimated to be 3 to 14 days. The majority of people infected with Zika virus do not develop symptoms. And symptoms are generally mild, including fever, rash, headache, joint pain, conjunctivitis, and muscle pain. So these mild symptoms lasting for only several days to a week. People usually don't get sick enough to go to the hospital, and they very rarely die of Zika. For this reason, many people may not realize that they have been infected. Symptoms of the virus are very similar to other viruses spread through mosquito bites, like the dengue and the chikungunya. So the diagnostic procedure of the disease: first, testing blood or blood-derived samples in serum or plasma and urine. This generally provides a sensitive test combination for the diagnosis of the viral disease cases and for assessment of pregnant women's exposure to the said virus. Next is testing of cerebrospinal fluid or CSF by RT-PCR and enzyme-linked immunosorbent assay or the ELISA. These have been indicated in order to establish Zika virus as the cause of the outcome. And next is the CDC-DENV-14 RT-PCR test. So these tests have been evaluated and validated for serum, urine, CSF, amniotic fluid, and whole blood, and in high and low input volumes, and with several RNA extraction procedure, equipment, and automation protocols commonly available in public health laboratories. And lastly is the trioplex test. This test is designed to detect and serotype dengue virus disease or infection. So the treatment modalities, the same with the Ebola virus, there is no specific medicine or vaccine for Zika virus for now. The treatment is aimed at relieving symptoms. This may include getting plenty of rest, drink fluids to prevent dehydration, do not take medicines such as acetaminophen to reduce pain or fever. Then take aspirin and other non-steroidal anti-inflammatory drugs or NSAIDs until dengue can be ruled out to reduce the risk of bleeding. So next is the nursing diagnosis. First is acute pain related to severe retroocular headaches and joint pain, and hyperthermia related to increased metabolic rate and dehydration. Fluid volume deficit related to excessive sweating and dehydration. And knowledge deficit related to lack of exposure and information about the disease process, its treatment, and prognosis. So, these are the list of nursing management for the disease. Relieve pain. So, acknowledge the reports of pain immediately, getting rid of additional stressors or sources of discomfort whenever possible, and then provide rest periods to promote relief, sleep, and relaxations. Determine also the appropriate pain relief method. Provide analgesics as ordered, evaluating the effectiveness and inspecting for any signs and symptoms of adverse effects. Next, decrease fever. So, eliminate excess clothing and covers. Give also antipyretic medications as prescribed. Encourage ample fluid intake by mouth. Provide high-caloric diet or as indicated by the physician. Include also education for patient and family members about signs and symptoms of hyperthermia, and help in identifying factors related to occurrence of fever. And lastly, discuss the importance of increased fluid intake to avoid dehydration. Next is provide adequate fluid volume. Urge the patient to drink prescribed amount of fluid. Emphasize the importance of oral hygiene. Provide comfortable environment by covering patient with light sheets. And administer parenteral fluids as prescribed. Then consider the need for an IV fluid challenge with immediate infusion of fluids for patients with abnormal vital signs. Then provide measures to prevent excessive electrolyte loss, and administer also antipyretic medication as prescribed by the physician. and teach the family members how to monitor output in the home and instruct them to monitor both intake and output of the patient. So lastly, educate patient and folks. So grant a calm and peaceful environment without interruption. Provide also an atmosphere of respect, openness, trust, and collaboration. Include also the patient in creating the teaching plan, beginning with establishing objectives and goals for learning at the beginning of the session, and then provide clear, thorough, and understandable explanations and demonstrations. And then when presenting a material, start with the basic or familiar, simple and concrete information to less familiar, complex ones, and allow also repetition of the information or skill. So the prognosis of the disease. Most cases of Zika virus infection are mild and resolve on their own. However, serious neurological disease has been reported, including Guillain-Barré syndrome. In addition, there is great concern that the virus can induce congenital brain and eye malformations if acquired during pregnancy. So now we'll move on to our last topic. We will be discussing about SARS. So what is severe acute respiratory syndrome or SARS? It is a viral respiratory disease caused by a SARS-associated coronavirus. SARS is an airborne virus and can spread through small droplets of saliva in a similar way to the cold and influenza. It was the first severe and readily transmissible new disease to emerge in the 21st century and showed a clear capacity to spread along the routes of international air travel. So, a virus known as SARS-associated coronavirus causes the illness. It was first identified in April 2003 and is a member of Coronaviridae family, which also includes many of the viruses that cause a common cold. So this virus was also a zoonotic disease, meaning it was of animal origin but passed onto humans. So some animals can carry a virus without becoming sick because their bodies are accustomed to the virus. This means that they are likely to have an immunity. But when a new virus first emerges, people do not have immunity. In time, the immune system develops antibodies for the new virus, and these antibodies equip it to fight the resulting disease. So these are the risk factors of the disease. Number 1 is age. Next is the gender, and lastly, comorbidities or the underlying disease of the patient. Namely, examples are diabetes mellitus, chronic respiratory failure, chronic renal failure, and immunosuppression. So, the pathophysiology of the disease. The SARS-CoV or the virus causes infection of trachea, bronchial, and alveolar epithelial cells. And then it will cause a direct viral cytopathic effect, including induction of apoptosis and infection of immune cell. So this infection may disseminate to other organs. So this will lead into depletion of immune cells. Then the innate immune system may have an insufficient interferon response, and excessive expression or secretion of chemokines and cytokines. And thus, this will result into excessive recruitment of immune cells. And then the adaptive immune system will have an autoantibodies, and there will be a downregulation of ACE2. So this will all may lead into severe lung injury. So these are the signs and symptoms of the disease. Fever over 100.4 Fahrenheit. Next is dry cough, sore throat, problems of breathing, including shortness of breath, headache, body aches, loss of appetite, malaise, night sweats and chills, confusion, rash, and diarrhea. So, complications. Most of the fatalities associated with SARS result from respiratory failure. SARS can also lead into heart failure and liver failure. So the group most at risk of developing complications is people over 60 years old and who have been diagnosed with other chronic conditions. So diagnostic procedures of the disease. Various lab tests have been developed to detect the SARS virus. So during the first outbreak of SARS, there were no laboratory tests for the disease. Diagnosis was made primarily through symptoms and medical history. But now, laboratory tests can be performed on nasal and throat swabs or blood samples. A chest X-ray or CT scan may also reveal a pneumonia that is a characteristic of this viral disease. So next is treatment modalities. So there is no confirmed treatment that works for every person who has SARS. Antiviral medications and steroids are sometimes given to reduce lung swelling but aren't effective for everyone. So, and supplemental oxygen or a ventilator may be prescribed if necessary. And in severe cases, blood plasma from someone who has already recovered from SARS may also be administered. And also, some severe cases may require tracheal intubation and mechanical ventilation to support life until recovery begins. Severe ill patients should be admitted to the ICU. Thus, no medications, as I've said, there's no medication have been proved to treat SARS effectively, and this treatment are supportive and directed by the patient's clinical conditions. So, how to prevent the spread of the virus? So first is by washing hands regularly with clean water and antiviral soap or antibacterial soap. Next, avoid touching eyes, nose, and mouth. And use disposable tissue instead of hands to cover mouth when coughing and sneezing, and throw the tissue away immediately after the use. So these are the nursing diagnoses for the disease. First, deficient knowledge related to unfamiliarity with disease transmission information, and hyperthermia related to increase in metabolic rate, impaired breathing pattern related to shortness of breath, and anxiety related to unknown etiology of the disease. So, these are the nursing interventions. First, monitor vital signs. We should monitor the patient's temperature. The infection usually begins with a high temperature. And monitor the respiratory rate of the patient, as shortness of breath is another common symptoms of this disease. So next, monitor the oxygen saturation of the patient because respiratory compromise result in hypoxia. So next is maintain respiratory isolation. Keep tissues at the patient's bedside. Dispose the secretion properly and instruct the patient to cover mouth when coughing and sneezing. So next, enforce strict hand hygiene. Teach the patient and also the significant others to wash hands after coughing to reduce or prevent the transmission of the virus. So next, manage the hyperthermia. Use appropriate therapy for elevated temperature to maintain normothermia and reduce metabolic needs. And lastly, educate the patient and the significant others. Provide the information on disease transmission, diagnostic testing, disease process, complications, and protection from the virus. So, the prognosis of the disease. The mortality rate has been found to range from less than 1% in patients below age 24 years old to more than 50% in patients age 65 and older. Certain risk factors include the following that have been associated with a poor prognosis: older age, chronic hepatitis B infection, and laboratory features. This may include marked lymphopenia and leukocytosis, elevated lactate dehydrogenase level, hepatitis, high SARS-CoV viral load, and comorbidities such as diabetes. So that would be all. Thank you for listening. Hope you learned something.